is the multiple studies that showed the likelihood of further rupture or damage or re-tear because of the deleterious effects that cortisone has that is catabolic and cytotoxic to tenocytes and chondrocytes and many other things. What is up, everyone? Hope you're doing well today. We're going to talk cortisone shots. Millions are distributed every year, and osteoarthritis is considered the #1 disability in people globally. Oftentimes, you're given a cortisone shot due to an injury, because of prolonged arthritis and or potentially after surgery to reduce inflammation. There's been 2 instances where I've been offered a cortisone shot and I've declined both times. I'm going to go through why I decided that and some of the reasons and the research I found that led my decision to do alternatives. First, let's start with what a cortisone shot is. Essentially, a cortisone shot is synthetic cortisol, and cortisol is our stress hormone that's released in the body when the body is under stress for a different litany of things, like releasing glucose from the liver and downregulating things that are not going to be advantageous to our immediate survival. So when you take this synthetic cortisone and inject it into an area that is injured or potentially needs healing, it's not great because it's catabolic. And catabolic means it is the breakdown of things or can be deleterious to tissue. It's needed in some instances, but we don't necessarily want that, especially when you're healing from an injury. You want to be anabolic, growth. You want to be, growing things. So the cortisone shot binds the glucocorticoid receptors, and that inhibits certain things. So proliferation will be a key one that it inhibits, and that is the dividing of cells. So tendons and ligaments are much more hard to heal because there's not much vasculature going to them. So they require a lot of nutrients, and once they start breaking down, it becomes very difficult to build them back. Cartilage, specifically articular cartilage on the end caps of bones, like in your knees, it creates this smooth surface for articulation and is required for the movement of your knees and other joints. Cartilage is avascular, meaning without vasculature, there's no vessels going to the cartilage. So it requires diffusion through synovial fluid to get its nutrients. The issue is the cortisone shot, one, inhibits proliferation of tenocytes and chondrocytes. Specifically, it's cytotoxic or bad for those cells. Chondrocytes are your cartilage, tenocytes are your tendons, and it's very deleterious to those. 2, once you get a damage in the chondrocyte itself on that articular cartilage, it's like a crack in the windshield. It's very hard to repair and starts growing. Well, the cortisone shot only deteriorates that more. Remember, it's catabolic, so it breaks that down even further. Sure, it may reduce inflammation. Sure, it may reduce pain, but the half-life of cortisone shots is several weeks. And when you're getting a constant catabolic breakdown of things, your instance of injury increases significantly because cortisone has shown in study after study that it increases the likelihood of potential rupture of tendons and further damage to cartilage. And it reduces the tensile strength that tendons can have, leading to rupture, which they saw more instances of rupture in lateral epicondylitis, which is tennis elbow, with people that got injections. And then there was a VA study that was done, and there was a 7-fold increase on rotator cuff tears after injections, and they either did 1 to 4 injection. Now, some people will say, well, you only get 3 a year and you have to stay to the recommended dose, and that's right. But they've shown even at low doses, after 1 injection, the cortisone works negatively and is cytotoxic to these cells, doesn't allow for proliferation, and increases apoptosis, which is programmed cell death. So in essence, the cortisone shot is a band-aid for a short-term pain for a long-term issue. And if you want to not have worse arthritis or osteoarthritis or pain in your hips because knees and hips are very low bearing, then there's alternatives that you can do and things that you can mitigate all these things for. Of note, like I said in one of the other videos, weight training is not going to cause arthritis. It's actually a way to prevent it, and I'll explain how. All right, so this is more specific to osteoarthritis of the knees because that's one of the #1 disabilities globally, and many people do end up getting osteoarthritis. One of the best ways to prevent that is through food and through proper mechanical tension on that joint. And physical therapy has been shown to over the course of 1 year, do more benefit for people with range of motion, functionality, and pain reduction than the cortisone shots would do. Because when you get a cortisone shot, your body adapts. You need more cortisone shots more frequently, and therefore you're adding more deleterious effects on those cells that are needed in that cartilage, and it's very hard for those cells to grow back. The primary way that these chondrocytes in these cells in that articular cartilage get nutrients is through diffusion, which is essentially a passive movement of molecules through a membrane from a concentration of high gradient to low. Anyways, chondrocytes essentially get their nutrients from the synovial fluid via diffusion. When you don't put those joints into motion and you're sitting for prolonged periods of time, not using your knees, that synovial fluid kind of gets stagnant. The diffusion process downregulates, therefore it doesn't provide nutrients needed for those chondrocytes to stay healthy. And then once you get a crack, it's hard for them to heal. So movement is key. And then you put mechanical tension, proper weight, proper loading on those knees. That's going to increase the amount of diffusion happening in that synovial fluid, therefore increasing the amount of nutrients that get to the permeation of the chondrocytes at the articular cartilage. So when you introduce a cortisone shot, it downregulates that diffusion process as well, and therefore doesn't allow for, not only is it cytotoxic, doesn't allow for diffusion to happen, and then those chondrocytes can't get those needed nutrients. So number one thing, move. Don't sit all the time. You need to get those joints moving. That's one of the best ways that they can get their nutrients they need, and do proper weight training and potentially physical therapy if that's needed to strengthen and build those muscles around that joint, because you got to think above and below the joint to take off compression from that joint and stress from that joint. To strengthen the muscles around there is best. And to load them with some sort of resistance training weight is going to be beneficial. Doesn't mean you have to be squatting 315 pounds. That just means some lunges, some wall sits, walking, even just doing air squats is going to be good for the articular cartilage so that it can remain healthy, and then you don't end up bone on bone in your joint. Another thing that's going to be important is nutrition, because the type of food matters. If you're eating highly inflammatory foods, that's creating an inflammatory environment for the body. Therefore, that diffusion process to get nutrients is disrupted, and it's truly underestimated how much nutrition and metabolic health have on so many things in our body. Me personally, instead of getting a cortisone shot for my knee injury, I got platelet-rich plasma, which I'm going to make a video on what you should look out for if you're interested in that. But essentially what they do is they draw your blood, they spin plasma, they pull that plasma off the blood, and that carries a lot of fibrinogen and nutrients that go directly into tendons typically that are damaged or need help repair. And because tendons don't have a lot of vasculature going to them, you directly inject those nutrients into it, helps heal it. Also, it kind of ignites a small response in the body of like, this is an injury. So you go through the inflammatory cascade that is needed in injury healing. So you get growth factors, and then you get all sorts of different things that the body are doing to heal that. Super beneficial for me. I would highly recommend looking into it, finding the proper clinic. Alternatively, there's another method, and new emerging research is coming out for cartilage. Because cartilage is derived primarily from stem cells that we have in our body, they do a procedure where they drill small holes in the bones that releases bone marrow, therefore releasing stem cells, because that's where your stem cells lie. So these clinics that now do stem cell procedures, they're onto something with injecting stem cells into like a shoulder capsule to help build back cartilage, because chondrocytes are the cartilage cells that are directly derived from stem cells. So to increase those, they can then differentiate into chondrocytes and help build back. More research is coming out about this, potentially showing significant increases in healing that cartilage, and then also decreasing significantly the likelihood of re-tear happening. So for me, that was another thing that I decided was an investment for me. And I went to Ways to Well, shout out to them, because they did an incredible job and their team is awesome. Highly recommend looking into physical therapy. One final thing to consider is weight. For every extra 10 pounds of weight is 40 pounds of pressure on your joints and your knees and hips specifically. So 20 pounds of excess weight is going to be 80 pounds of excess pressure on your knees. That is not insignificant, and that is not the beneficial weight we're talking about. If you have constant weight on your knees, it's going to lead to knee pain. And of course, alcohol dries everything out that's deleterious to synovial fluid. The moisture in synovial fluid is primarily driven from hyaluronic acid because it holds 100 times its weight per molecule in water. If you're dehydrating yourself, you're going to dehydrate your joints, leading to cartilage breakdown and then eventually bone on bone. Not something you want. So it's important to understand what a cortisone shot is, and much of the research that led me to make my decision to not get one is the multiple studies that showed the likelihood of further rupture or damage or re-tear because of the deleterious effects that cortisone has that is catabolic and cytotoxic to tenocytes and chondrocytes and many other things. I did not want to increase the likelihood of rupture or damage done just for short-term pain relief. And some may argue, well, you have to get over the hurdle of pain in order to do the things. Well, I looked at it as sure, or I can invest more time and more effort into learning about what I need to do and therefore getting my long-term investment, not a short-term bandage for the issue. And it's worked for me. So the goal is for you to have the conversation. Don't just sit there and say, yes, I'll take a cortisone shot. Weigh the options, look at the potentials, and decide with your doctor, with your provider, if that's the right decision for you. Not just say, yep, let's go with it, because long term, the research does not look great for preventing further damage. I wrote an article about this on solutionstowellness.org. Share this with someone that is potentially getting a cortisone shot or has looked at that as an option, and have the discussion and share this video with them.